Hello and welcome to Arogyam Hair Transplant Clinic. I am Dr. P.J. Mazumdar. So today I am going to discuss about the use of Finasteride in hair loss. So Finasteride is a very old medicine, has been used for so many years, and it has been proven to be successful. But there are some controversies associated with it. So I will discuss all this today in short. So the development of finasteride is interesting. It was not developed as a drug for hair loss, but instead it was developed as a drug for BPH, benign prostate hypertrophy. So it shrinks the prostate gland in those in whom it is enlarged. But while testing the medicine for this, it was found that it increased hair. It stopped hair loss and increased the hair in balding persons. So that is how it was repurposed as a drug for hair. So how it works is by decreasing the amount of DHT, dihydrotestosterone. So what happens is that the hormone testosterone in males, a part of it gets converted into DHT. So testosterone is converted into dihydrotestosterone. And it is this dihydrotestosterone which is present in the scalp which is believed to cause hair loss. So what finasteride does is it blocks the production of the testosterone into dihydrotestosterone. So the amount of DHT decreases, and this is how it is believed to stop hair loss. So dose of finasteride is 1 milligram per day. So in BPH for prostate hypertrophy, it was used in the dose of 5 milligram per day. But for hair loss, we use it as 1 milligram per day. So that is usually not given continuously. What we do is give some gaps, like say 5 days a week, or we advise a patient to take it for 6 months and give a gap of 2 months, and so on. Another question that arises is how long to take finasteride. Now, baldness is a lifelong disease. So once a person starts getting bald, it will continue to develop throughout his life. So finasteride also is to be taken throughout life, or at least as long as the person is concerned about his hair. So usually when a person starts finasteride, he needs to take it for years altogether, for 5 years or 10 years, or as long as he is still interested in retaining his hair. So now we come to the side effects of finasteride. This is the controversy regarding finasteride. Otherwise, it is fully beneficial. It has all advantages. It has been proven to grow back hair. But the only thing is the side effect, and side effect is mainly sexual side effect. So it is believed to decrease erection, to cause erectile dysfunction. Also, it is believed to decrease the volume of ejaculation, and also it causes loss of libido. So these are the main controversies. These side effects were not found initially, but it was only after some years that these side effects were discovered. They occur in a very small percentage. And another thing is that there are no very large studies on this. Most of the studies which have gone into this are generally small studies, and so it is not clearly proven. Even those studies which have proven this are still cite this effect in a very low percentage, less than 2%. So there is whether it actually causes these side effects or whether it is just in the imagination of some persons. That is still the controversy. Some people insist that it is true, some people insist that it is not. But in any case, it is not more than 2%. So when anybody plans to take finasteride, these are the side effects that he must take into consideration. So because of the possibility of these side effects with finasteride, topical use of finasteride has also been discovered, is now advocated. So it is usually given along with minoxidil as a topical solution, as something to apply and not to be taken orally. But the effect is less in topical use. So overall, when making the decision of whether or not to take finasteride, we have to weigh the risks against the benefits. So risks, as they say, are these sexual side effects. But as we said, it is a very low percentage of people who actually have these effects, and we can stop the medicine as soon as it occurs. But another thing is that some people say that the effects persist after stopping finasteride also, but that also is very controversial. Not many scientists are willing to accept that, but there is a very determined advocacy group for this in the US, which works relentlessly, we might say, against finasteride. But it is the duty of every patient who is prescribed finasteride and the duty of the doctor to explain the possibility of these side effects. So the patient needs to be well informed about this, and ultimately the decision comes to the patient. So my advice is that you can take finasteride. You can take finasteride, but only we will observe for the side effects, because finasteride has been proven. There are several studies regarding this, has been proven to work against hair loss, and it does work. So in conclusion, I would say that I would advise you to take finasteride. But you must be aware of these side effects. You must know what the side effects are, and accordingly the decision is ultimately for the patient. If at all you feel that you cannot take even a small risk, then we can go for topical finasteride, or we can avoid it altogether. It is not that it is something which is life saving. So if you feel uncomfortable with finasteride, you can stop it. So you can come to Arogyam, we'll examine you, we'll check you, we'll discuss about finasteride, and there are many other treatments for hair loss. So if you don't want to take finasteride, we can go for other forms of treatment also. So come for a checkup, let us see, and we can discuss all these concerns about you.